Welcome to COIQ, a first-of-its-kind video program about health innovators, early adopters, and influencers, and their stories about riding the roller coaster of healthcare innovation. I'm your host, Dr. Roxy, founder of Legacy DNA Marketing Group, and it's time to raise our COIQ. Welcome back, COIQ listeners. On today's show, I have Matthew Holt with me. He is the founder of the Healthcare blog, co-founder of Health 2.0 conferences, and you might know him even more by his Twitter handle at BoltyBoy. Welcome to the show, Matthew.
Roxy, it's a real pleasure to be here. Great to get to know you a little bit. I'm looking forward to chatting.
Yeah, I'm looking forward to having a very candid conversation with you about riding the roller coaster of healthcare innovation today.
I hope it has an up phase as well as a down phase. We'll see.
Yeah, so let's shoot it straight today. So, there's a lot of people out there that already know who you are, but just in case some of our listeners don't, take just a couple of minutes and share with us a little bit about your background and what you do.
So what I do now mostly is I don't know what to say. I say I do health technology and early stage innovation stuff, because what I actually do in that, I'm sort of bathed in that milieu. Way back when I was a sort of poor English graduate student hanging out at Stanford trying to figure out what to do with my life, and I ended up stumbling into the politics and policy of Japanese and American healthcare, if you can believe that. I ended up in a big funded project looking at those two things. And I was kind of like a health policy, health business guy. And I did a lot of work back in the early 90s looking at, the evolution of the U.S. healthcare system. I basically did the U.S. half and did a little bit on Japan half. Funny enough, I've been back in Japan the last few years, but there was a long period where I didn't touch Japan for whatever reason.
Okay.
And I ended up getting my first consulting job out of Stanford was at a place called the Institute for the Future. And the Institute for the Future was this crazy sort of research think tank sitting on Sand Hill Road, right next door to the venture capitalists at Kleiner Perkins. And it had research and consulting in two areas. One was healthcare, and one was technology. And really the two of them didn't mix. And somebody somewhere had sold a project to a bunch of tech companies about healthcare, and they sold a bunch of health plans that will do projects about technology. And no one did it. And I walked in the door and they went, "Hey, you're doing this project." So I spent the 90s learning about healthcare. I knew a bit about healthcare already, learning about technology and putting those two together and running a project about that. And what eventually happened was that was the same time that the web was taking off and the internet was taking off. And, everyone was joining the .com e-health craze. And even I, at the end of the 90s, joined a startup doing, .com health stuff. And so I had about a decade like getting immersed into that. And then the next decade, which was the sort of the early 2000s, I spent a bit of time on the beach post.com. But after that, I did a lot of consulting work for mostly with tech companies about the healthcare system. But as you pointed out, I also started this blog called the Healthcare blog, because that was, the techie thing to do. So you started the blog back in 2003, right? When there was Instapundit and Daily Kos and about 10 other blogs. And actually, probably what made that the career was that in 2004 or 5, the Wall Street Journal wrote an article about, the top blogs by industry, and the healthcare blog was the healthcare industry's, blog of record, the one that, it was like a year and a half old or whatever at that stage, and maybe had 27 readers a day. Anyway, and that helped it take off because people sort of got a bit of notoriety. The other thing that was going on at the time, so that the blog, and it still goes on, the Healthcare blog, please go there, do read it. It's all about healthcare business, healthcare policy, healthcare tech, has a lot of video of me and others and great articles.
I just got a new one today in my inbox.
Absolutely. At that time, I was also kind of following up on that stuff I'd looked at in the 90s, like the little companies that were still doing healthcare and technology on the internet. And there weren't many of them around because the whole thing had imploded with the .com bust, but there were enough. It was just getting interesting, and then Google went public, and there was a bit more money around. And by 2007, I ran into somebody called, in 2006, I ran into somebody called Inu Subaya. And Inu's a doctor who had a clinical background but went into business. And I said, there's enough of this stuff to be interesting. And she was doing a bit of research into it as well. And I said, a bunch of these people I've been talking to who have these little companies said, "Why don't you do a conference?" And I went, "Well, that'd be fun. I don't know anything about doing a conference." And she went, "Yeah, you should do a conference." So we did it, and that became Health 2.0. And by, the mid-teens, we had a couple of thousand people come to our big conference in Santa Clara, California. We had, maybe 300 or 400 presenters. We had dozens and dozens, more than 100 live demos at every conference. And we had conferences in Europe. We had spin-off ones in South America and Japan. And, we had a lot of activity going on. Eventually, that conference business started doing a lot of other consulting and technology innovation work. And then 2017, so just 2 years ago, HIMSS purchased the conference side of it. India and I still run the bit called Catalyst, which does kind of challenge competition management in technology. Right now we're running some for the Robert Johnson Foundation, and your readers who have an application in the social determinants of health or in community and home-based care should be entering that competition. It has prize money, free to enter.
Okay.
And just one of the many things we're doing at the moment there. And then I also have created a business called SMACK.health, which basically does early stage startup advisory, early to mid-stage startup advisory, helping CEOs figure out, how they should be presenting themselves to the outside world, helping figure out their business models. Some of the stuff that's sort of probably a precursor to what you do. We don't really get into the fast commercialization stuff, but we do it. We do kind of help around, making sure that your deck looks semi-sensible and figuring out who you should be talking to about venture capital, that kind of stuff. So I do a bunch of different things, and still write and talk and appear on stuff like this. So
yeah.
A bit about me, my professional life.
Awesome. So, as you just described, you've been around healthcare innovation for, decades now. So what's your take on what it's like riding the roller coaster of healthcare innovation today?
Well, I think the roller coaster part is highly dependent on two things, right? So there is the up and the down, and we're still in an up phase, but I think people are looking at the very top of this and going, what happens next? So one is that it's connected to the tech business as a whole, which of course has been on a massive surge up. Essentially, there was a bit of a hiccup, in the early 2000s, and there was a bit of a hiccup in 08, 09 in funding. But in general, the transformation of society by the people who sell us, these cute devices, and by the people, and the box that comes, onto your front porch, and
Sure.
the ad that comes in when you type something into the search engine. You know who I mean, right?
Yep.
The transformation of society that has been dramatic, and health technology has kind of attached itself to that, especially the funding part. So there was a decent amount of activity in the 90s, but that really was too early. There wasn't much activity in the early 2000s. By the late 2000s, it was starting to happen. It got interrupted by the crash in 09. And then since 2010, we've really had an uninterrupted amount of funding going to, whatever you want to call it. Some people call it digital health. Some people call it post-digital health. I call it SMACK.health. Doesn't matter what you call it. Right. So the sector of technology, of health technology that is sort of on the cloud and is aimed at sort of end users like consumers and clinicians, right? And that has gone from, some of the numbers suggesting 1 to 2 billion in the 2010, 2011, and then estimates range between 8 billion and 15 billion in funding last year. Mm-hmm. So that's still going along. So one area, that's on the roller coaster is the funding cycle and how much there is available. And we're seeing, just today, Pinterest goes public. Last week, Google goes public. We're seeing a lot of interest in what are still loss-making businesses going public on the stock market. There's a lot of money around for that. We'll see how long that lasts.
Yep.
The second and equally important part is how's the health system reacting? And I think this is really interesting because you've got kind of two approaches. One is we're going to sell tools to the health system incumbents to make them more efficient and more effective. And most health technology companies view that as the way forward, and they're looking at either selling to drug companies, hospital systems, device companies, selling into big provider organizations, or health plans, or government agencies, whatever. They're selling stuff to the incumbents with the hope to make them do better. Mm-hmm. There's a small slice out there, but some of them very highly funded, that people saying this is not like selling Barnes and Noble or Borders a better online experience for their bookstore. This is about putting those guys out of business. We want to be Amazon. And that there are ways to replace the current incumbents by figuring out better ways to deliver a health plan or better ways to create a primary care group or what have you. And that sector to me is very interesting because if you look at healthcare across the board, it's only got bigger, more bloated, and more inefficient and more ineffective over the last 2 decades, and more expensive and put its prices up. And if you look at the satisfaction with it, to end consumers, patients, people who have to use the system, it's going down, and access to it is, although it improves slightly with the ACA, is still going down. That wasn't the solution that, that it could have been, which is why, on the one hand, you've got a lot of grumpy people sort of on the right, and on the left, talking about free market stuff, and on the left, you have the Medicare for All campaign. So I think it's really interesting to see if there's an opportunity to kind of really replace the way we do healthcare now, or whether we're just going to sort of keep down the path of growing the US healthcare system, adding new technology, but not really changing what it does fundamentally.
Yep. So just kind of building on that, everything that I know about you is that, you're a futurist, and, you kind of observe these patterns and trends, right? And you kind of just touched on some of that and kind of forecasting what's next. So where are we going? And, what does the future hold for entrepreneurs who are bringing innovations to market?
Well, I think this is interesting. I've actually literally just got off a call about what I'm going to say in Europe in a conference, Health 2.0 HIMSS Europe in next month. And it's we've been talking a lot about activities there to sort of unleash the consumer side from their more standardized state-based systems. And they've got actually things like doctor booking mechanisms and AI tools to help support the front end of of consumers reaching doctors. Actually growing quite fast over there and being well funded over there in Europe. And to some extent, that's been growing for entrepreneurs. That's been growing quite fast here. We've seen quite a lot of activity towards consumers. I'm thinking about the telemedicine companies. I'm also thinking about the bricks and mortar companies like urgent care and what have you, who've been getting out there and changing the consumer experience a little bit. And there's some survey data from Accenture suggesting that there's a significant difference between sort of old farts like me, who care about their doctor relationship, and younger people like you, Roxy, who are less attached to any individual doctor or system and are looking for more convenience, and which is why you've seen the growth of urgent care, and there's sort of demographic change there around the age of 50, roughly. So that's, I think, one thing is what can you do to sell direct to a consumer, and there's a lot of opportunities in that area, especially as probably it's going to stay this way, that the US is staying in a higher deductible, more consumers paying the first few $1,000s out of pocket system.
Yep.
The problem or the issue or the underlying thing for the system is that that's all well and great. Most people use the system like that. Most people have modest health issues. Most people will have, their kids get sick or whatever. They want to see urgent care. They want to see health. You're going to see a bunch of stuff around that. But most of the money and most of the problem is attached to a few people who are sick. Right.
Yep.
And those people are the ones who the current system makes all its money off and gives a pretty bad experience to, because what we do in the current system is we do a lot of procedures to people. We don't do very good management of people with chronic illness, who are the people who cost all the money. And I think, one of the interesting things is to look at what is the right unit at which to approach a better system for managing those chronically ill people, and essentially stopping them going into the emergency room, stopping them going into the hospital, stopping them having kind of unnecessary doctor visits, but monitoring and managing them while they're in their home or while they are, where they, as my friend James Stretson Khan, who's wrote a book called Health Consuming, says, where they live, work, play, and pray, right?
Yep.
Where are the places that people are going that you can impact them? And you're seeing some very interesting companies who are trying to, put sensors in the home, put sensors on people, and build a system where they can track and manage and monitor them, and then start figuring out what they can do to intervene with services like nurses calling in or doctors going to the house or what have you. And I think that the key for entrepreneurs is to figure out what's the unit where they're selling to in that. Are they selling to a health insurance plan like a Medicare Advantage plan? Are they selling to a hospital system that's now taking some risk? Are they selling direct to consumers? Are they selling to employers? There's a lot of sort of questions about who is the answer? Who is responsible for those patients? Are they selling to patients? Are they selling a service to people my age for their parents who are still living alone in their 80s or what have you? So I think that's a big question: is that if you're going direct to consumer for something that's cheap and easy, or if you're something complex, but it's going to reduce healthcare costs and improve the care of people with multiple chronic illnesses. What's the right unit? How do you prove that out? And then the next point is, when I say prove it out, how do you get clinical data to validate what you're doing?
Yep.
When I say clinical data on how they're doing, it means,
Yeah.
how do you prove that this thing actually works? And there's a lot of controversy about that as well, by the way.
Absolutely.
So, a lot of people thinking that some of these wellness plans are not effective and don't work. And a lot of companies have kind of got in there, done the sort of move fast and break things and get in there and start running the programs without really proving that out.
Sure.
A lot of controversy about that as well.
Yep, absolutely. The efficacy of those things. So have you come across any pretty unique business models that you think maybe either become a challenge for that innovator or become a opportunity for them?
Well, there are a lot of challenges because the main people who hold the money now are either large and somewhat sclerotic insurance companies who don't really want, there is some experimentation on there, but don't really want to jump in and do something very new and have very established relationship with provider organizations, or are provider organizations who are thinking about getting this new world of taking risk and doing value-based care, but in general make all their money doing fee-for-service and, want to make sure their beds are filled. So I'll give you one example. I have a company I work with which has an interesting program for reducing readmissions post-hospital discharge. So as you know now, hospitals don't get paid if they readmit a patient after 30 days, within 30 days. And there's a lot of controversy about that. What you're seeing is a lot of argument about whether that's effective or not, and a lot of readmissions on day 31 and 32, right?
Sure.
So this company is struggling to find people, because they believe they can reduce readmissions permanently by doing stuff in the home. So they're kind of struggling to prove that out because they can't find enough people, hospitals who go through the system. And then not only is the issue of, well, how do I prove something out that, that's going to stop the readmission on day 31 when the hospital gets paid again, but also they're having the really basics where they'll sell this to the sort of finance person or the marketing person. Somebody in the organization, the administration will buy this, but then they have to go and have a conversation with somebody who's running a bunch of nurses calling on the phone and change their workflow. And that's really hard. And eventually, a lot of those times it gets stuck there. You have the meeting and at the third meeting, the person running that group goes, I'm too damn busy. Why do I want to change this? What we're doing is okay.
Yep.
And stuff gets stuck in the kind of implementation phase or even before the implementation phase, right? The sign off from those people on the front lines. And, this is a thing that Sachin Jain at CareMore, he says there's like a delivery layer and an innovation layer, and these two things don't talk very well. And that's a big problem because you have millions and millions of people in that delivery layer, a bunch of us running around this innovation layer. And there are people in these organizations, there are innovation groups, there are funding groups trying to cross that bridge, but rolling out these new systems within these organizations is very hard.
Yep, absolutely. So I talk about this stat often, that research indicates that 95% of innovations that are brought to market fail to reach any adequate level of customer acceptance or profitability. And so the question that I have for you is, as someone that's had your ear to the ground for so long, why do you think some healthcare innovators fail and some succeed?
So I think a lot of it, way back in my career, before I even got to the US, I spent a tiny amount of time as a futures trader. And we used to joke that it's good to be good and it's good to be lucky, but it's better to be lucky than good, right? So what is lucky, right? Are you in the right place at the right time especially? So I've seen stuff that looks super cool now and is starting to succeed now that is exactly the same as stuff that was done 10 years ago. And that didn't succeed because the timing was wrong and they didn't get the right people. A lot of it is, are you at the right time? Did you get the right champion in that organization? Did you fit a payment stream that was coming online now that wasn't online 5 years ago, even though the result would pretty much be the same? So one of it is like luck and timing. And you can do something to kind of figure out if you are at the right time, if there's the right luck, and if the regulations or the payment stream is going the right way. The second is I hate to say it's relationships. It's a very relationship-driven business, and it takes a while to make those. And sometimes you can go around those relationships. You can move the Uber to the taxis or the Amazon to Borders and Barnes and Noble, But a lot of it, if you're having to go within that, you have to figure out the right relationship with those organizations. And those can be very tricky because those are very insular and standardized organizations have been around for hundreds of years.
Sure.
More than 100 years in some cases. And then I think the typical one, which I think is true, is kind of ignorance of the healthcare system. People basically coming from the outside, not understanding what the frontline experience of the clinician is, et cetera, and finding it just dies there. So, there's a bunch of reasons why you don't get it right. And I think allied to all of that, it's awful to say this, is that you need a lot more time and money than you think you do, which is by nature a problem when you're an early stage startup because you don't have much time or much money, and your investors could be, putting money in Instagram or whatever the thing that's going to flip to Facebook in 12 months and make a lot of money. And why do they want to see you out for several years? I think investors are getting wiser than that. But on the other hand, those pressures on startups and early stage venture-backed organizations are always going to be around.
Yeah, I have a lot of conversations around, folks that think that just because they've identified a problem and they have a product that they think is superior to anything else on the market, that it's going to be the shoe in, that it's going to automatically equal success. And, to some degree, there's a lot of zombie graveyards out there with these innovative products just kind of sitting in there, some waiting to be resurrected and some will never come back out to play. Absolutely. And look, I look at the world so I look at Apple Health Records, for example, which was based on a company which started the Health 2.0 called Glimpse. One guy called Neil Setti. Launched it, didn't start Health 2.0, launched at the Health 2.0 conference. Yep. And that's super cool. I was in a company called iBeacon in 2000 and 2001, which had basically exactly the same thing. And we went and tried to sell it to a whole bunch of people. And, and that's, and I'm sure that software is sitting in a box somewhere and could be resurrected. I don't know where it is. But part of that was timing, part of it was money, part of it was lack of, it was all these different things. But in the end, it was, there were underlying standards weren't there. A bunch of different reasons why it didn't work. But it really was the market wasn't ready for it. And, a big player like Apple decided they had time to take it and sort of force it into the market, which they've now done. So who knows? A lot of that. Pity. I'd like to have sold it to Apple and made a lot of money. But in those days, Apple was too poor to buy it back then, right? Right. Yeah. So what do you think the biggest pitfalls are to commercializing an innovation? Is it product market fit? Is it problem solution fit? Is it being able to get in front of the right people, surviving the long sales cycle, developing the clear business model? What's your
So I think it's the last two more than anything else. I think it's like the sales cycle just takes forever. Doesn't matter, you're going to take several months and then you're going to lose people, your investors going to lose interest, whatever. It's just going to take longer than you think, right? So I think the sales cycle. The other problem, and I run into this all the time with the startups I work with, is it's really hard, and this is not just in health, this is in any new startup field. It's very hard to clearly explain succinctly and effectively what it is that you do.
Yep.
And therefore, you end up getting bucketed as being something like, you're like this, but you're a bit different and whatever, and I don't get it. And then we have 17 of those, and it doesn't rise to the top. I right now have a super clever company I'm working with that's in the medication sort of management for consumer space. There's dozens of medication pill reminder apps out there, and it's really not easy to try to figure out how is it that you are different, better. What's the thing that you've got the data? Getting over that hurdle with in the first conversation or the first couple of conversations with investors, clients, customers, employees, whoever it is, right?
In 2 minutes.
Yeah, right. Sometimes you only have 2 minutes, right?
Right.
Even doing 15 minutes is super hard, and getting the chart to make that make sense is hard. And by the way, you may not be different to those other 17, so you may have to figure out what do you have to go away and build that is different, or you give up and find something that, or maybe your choice is you go and sell to one of those 17 or one of their customers and be a plug into something they're not doing or whatever, right?
Right.
But you're right. We go back to 95% don't make it. I think the odds are stacked against you in this business.
Yeah. Yeah. So what needs to change in healthcare to make innovation easier?
Oh, wow. Well, I think some of it is changing, right? So the FDA, Scott Gottlieb, who recently resigned as commissioner, really got behind Bakul Patel and his work in the FDA, sort of creating a sort of framework for allowing digital health technologies to be approved so long as they've gone through the right process, rather than every time a slight change in the device happens or the tech happens to have to put it back through the FDA approval process. So that, I think, is a good help. It was very funny to see when Scott Gottlieb left, who was a far-right libertarian, all these sort of liberals I know on Twitter were crying tears of sadness, genuine sadness, because they thought he'd done such a great job to help the field along. Not many Trump administration, heads of departments who left, the people are mourning. Anyway, so I think that's one thing. That's a help. But I think the biggest thing is how we think about paying for healthcare. And really, if you look at it, we are in a world where still, despite all the talk about value-based care, hospitals and doctors get paid for doing stuff. Yeah. And don't get paid for the outcome of maintaining health. And so this means that you have to do workarounds. You have to go to, as you have an innovation that's a service or a tech that's going to keep people healthy for longer, you have to go and try and figure out who the end payer is. And maybe the end payer is an employer, but they're not really the right people to be buying new types of healthcare delivery service. They really should be buying it from a third party, but they pay an insurance company. The insurance company doesn't care because they just make money on the markup. The hospitals don't care because they make money from doing more stuff. Until we change the way fundamentally we think about payment stuff, we are going to be slicing around the edges. Now, I'm optimistic that's going to happen. We hear a lot of rhetoric about it. Medicare is talking now about changing the way it pays primary care. There's more and more people in Medicare Advantage plans, and we could change how we pay Medicare Advantage so that it's really rewarding better outcomes, and there's less risk, adjustment around the risk assessment, or cheating and lying around the risk assessment scores that change how those Medicare Advantage providers get paid. However, I'm not incredibly optimistic it's going to change in the next couple of years, but I think we're heading in the right direction. But that's the biggest thing. If you could change that. That's for the sick people. For the healthy people who are paying out of pocket, I think we just need better communication that there are these other things out there. I mean, I'm stunned when I go to a crowd. I've been in 2 crowds recently where the audience was polled about had they ever used a telehealth visit. And these were people at a health technology conference, presumably all had, were upper echelon people.
Maybe early adopters.
And, the number is about 30% of them have ever had one. And it's not, the general population numbers aren't a lot better. You're going, why the hell not? It's already covered in your plan. It's easier and quicker than going to a regular doctor. I've done a bunch of them. And somehow
convenient.
Consumers haven't kind of made the leap to go, I can use these new tools for stuff that I'm going to be paying for anyway. I'm going to be paying at least my copay and probably more likely my entire cost up until like my $2,000 or $5,000 deductible.
Right.
So,
right.
I think there's an awareness factor on the sort of easy, cheap stuff. But what I think will help there is that the technology coming into the home, we have weightless scales. I have a blood pressure cuff sitting in front of me that, I bought for $30 at the drugstore. And that stuff's steadily all getting online. And there'll be more and more of that stuff in the bathroom. And more I see at-home testing companies being funded. In fact, 2 of them, Everlywell and You Check, I can't remember the name of the other one, just got big rounds of 30 to 50 million to do at-home diagnostic testing. So I think a lot of this stuff is going to come into the panoply of what we do. And there's a lot of that going on the Apple Watch and what have you. So I think for the sort of cheaper end, for the incremental, occasional acute stuff that we're basically healthy, we are going to be doing more and more at home, and people are going to get more and more aware of the type of options available to them. But there is still an awareness thing because, the healthcare system is the healthcare system and people don't really think it changes.
So when I hear you speaking, there's a lot of decisions, a lot of commercialization decisions that a health innovator has to make. And a lot of these are interrelated. Like, so for example, as you were talking about, depends on who is the buyer in who I'm identifying as my target market is then how I'm going to structure my value proposition. It's how I'm going to align my business model. And really, in order for me to have kind of this recipe for success, I've got to be able to have some type of decision-making framework and really way to be able to identify how all of these are interrelated. How, when you're working with clients, how do you help them ask the right questions and kind of test and push and play devil's advocate on some of these assumptions that they're making?
Well, maybe I don't do it enough. I mean, I think the way is that what can they identify as the piece that they're going after, right? Mm-hmm. So I've got one client I work with who's got like a essentially personal health record thing, and I'm going, that's too broad, it's too general. You're not going to be able to sell that. Who do you think might buy this? And we worked it out, and we believe there's a space for them in clinical trial management and people being able to report back issues around if they got their data and make a report back what's going on with their issues in the clinical trial, that there is a definite target market there. So that's one way to say, how do you narrow down the focus of your small, something that you can make some traction on and go and figure out who the 5 people to call are, so you're not like trying to boil the ocean. Yep. I think, not that I'm deeply involved in it, you've seen some success of this kind of on the in the prescribing direct-to-consumer space. So a couple of successful companies, I mean, so someone like GoodRx, who's identified that you can present at the time of decision at the counter in the pharmacy a bunch of options to perhaps lower your cost, right? And then tell people exactly how that works by spending money on ads. Similarly, all the people doing now sort of telemedicine to get very specific drugs, usually for baldness or erectile dysfunction or birth control. So NewRx, Hims, Roman, a few others in that space, right? Mm-hmm. Pandia Health in the Bay Area, very much saying, we're not going to try and do everything for you, but that one specific thing, we can help you with that one issue, and we can take away barriers to going to your doctor and being embarrassed about the fact that you have, ED or whatever the issue is, and take away some of the cost. Now, don't forget, they've all had to say, well, we're going to go direct to consumer for this stuff that's basically cash pay, and we're going to have to market it like a direct to consumer product, which is very expensive. It means TV ads and buying Google ads and Facebook ads and really, trying to build a brand, which is not a cheap thing. But if they can do that, then they can slice off what should be a very profitable piece of the prescribing market, and you probably will end up seeing some of the big players in the drug store industry buying all of those guys up, I would think, if they're successful, or at least coming after them with their own version of it. Mm-hmm, mm-hmm. So, but I think in all those cases, they've taken something relatively small and gone after it, and then try to identify clearly to both their investors and to the buying public or their purchasers, in this case the consumers, what it is they're doing. Here's the 3 things that we fix for you. Come see us. And I think a lot of the problems of I see tech companies, especially B2B tech companies, is that they'll go to a big client like a health plan or a provider organization, and they can, they have their platform, and the client says, "Great, can you do this, this, and this?" And then they will build that up, and then they've kind of become a quasi technology consulting company to that client, rather than have something they can just stamp and repeat across many customers. But at least they're in the door there, and they've got a customer they're getting going. It's hard for them to get out of that mantra and sort of limit what they're providing. Right. It's a difficult decision set for an early stage company to wrestle with.
Yeah, absolutely. Are you customizing your solution for one customer, or are you making sure that you have something viable across the board, right?
Yeah, they can both be right solutions, but you're probably, if you go too far down one path, you're probably going to find it difficult. But on the other hand, you may launch this platform and make it available to lots of people, but no one might buy it because they don't want something customized, and you're kind of stuck there, right? So,
yeah, I think, when you and I were talking several weeks ago, we were talking about that example of someone that I have, spoken to that, they built a platform that they thought was going to be across the board for everyone, kind of a certain configuration for everyone. They landed a big account. They were so excited. It had a 3-year engagement. And over those 3 years, that client demanded so much from them and so much customization that they didn't have any time or attention or resources in actually building their company. And then they didn't renew the contract, and they were kind of scrambling going, oh my gosh, we only have a run rate for another 3 months. What happened?
Yeah. No, it's a very tricky business, right? You want multiple streams of recurring revenue. But you also need customers, because that makes you look good in front of investors. And like I said, the 95% failure rate is not a joke.
Yeah, absolutely. So, a lot of our listeners are health innovators that are in the trenches. So what advice do you have for them? What are some of the lessons that you've learned along the way that you would suggest for our listeners?
Well, I think a couple of things, right? One is to be incredibly honest about where you are. I was actually at a meeting talking about the ethics of leadership last night. Kind of bizarre. Mm-hmm. And there was one person from the startup saying, I have to pretend that I'm doing better than I am, because otherwise, investors will say, well, you're only doing that. And you have to stretch the limits of what's acceptable. And then you get people who go completely beyond those bounds and start doing really unethical stuff. And we've seen those examples in healthcare enough, and we've seen them outside of healthcare a lot, right? So I think one of the things is to be honest about where you are, and I think probably about who you are as well. So not every company has to be, the next insert name here, the next Pinterest, the next Uber, the next Google, right? A lot of it is you built a cool product which is going to fit fine in a bigger portfolio of somebody else's products. And there are plenty of players in healthcare who buy small companies and rebrand them and do stuff with them. And, we mentioned Apple buying Glimpse before, but, Optum, United buys a ton of companies and has done. There are plenty of other tech companies that buy other companies. And that may be a fine way to exit and get some scale. And it may not be, you may not be the next Steve Jobs or Mark Zuckerberg or whomever, but that might be a fine solution. So I think about where you are and what is your exit and scaling strategy. And then maybe it's not to be solo on your own. So that's the first one, and be realistic about that 95% number that we discussed. So I think that's probably my first and main piece of advice. And I mean, the second one on a more practical level is there are a lot of people, this is self-serving for you and me, Roxy, a lot of people who can help, right? Who know about healthcare and can, and don't be afraid to talk to them. Don't be afraid to get involved in organizations that are going to help sort of the overall ecosystem and get that conversation. Don't get too wrapped up in your own company, your own internal issues. Try and get not only yourself, but your team members, such as you have, out to sort of survey the general atmosphere. Because yes, you've got to be on, you've got to be selling, you've got to be doing whatever, but you've also got to understand that there is a wider world out there which can help you, and also where you can learn a lot about that you can bring back to your company, even though it may not be directly about the initial problem you have. It may be more wider stuff about the whole healthcare ecosystem. So I think, be realistic about yourself and look for external advice and feedback and, be breathing in the general ecosystem air, as it were, of all the things that are going on in healthcare, because there's a lot to learn.
Yeah, absolutely. I mean, I think it's so complex and so difficult. And a lot of the innovators that I come across that maybe have never done it before, they think that they have all the answers and they don't need any outside expertise. It's the ones that have tried to do it before, or the ones that have already done it, that are like, oh, this is not happening like I thought it was going to happen. But at that point, you still welcome them, right, with open arms. But at that point, they've burned through a lot of resources, a lot. And so, tapping into someone like, myself or like you early in that process is going to save them a lot of headaches and a lot of money.
Yeah, thanks. And by the way, I think the other thing I've noticed a lot is that there's a lot of gender-based traits in that one, right? It tends to be the men who won't ask for directions, and it's true. I have a lot of female CEOs in my network who are tend to be much more sort of realistic about where they are and what they're doing, and it's interesting. Perhaps men should become more female in their outlook here, I think.
Yeah, absolutely. That's really interesting. I'll have to marinate on that a bit. I've never caught that, but I bet you're right. And here's the thing, just like anything, when you're asking for help or get outside expertise, it doesn't mean that, that you don't you're not smart, that you're not good at what you do.
I
see the forest from the trees, right?
Yeah, the perfect anecdote is that Roger Federer, best player in the history of tennis, has a coach.
Yep, right.
He's not good.
Well, and you just can't see it when you're in it.
Better because he has one, right?
Right. I mean, how many times have you worked with someone that they might have spent, 6 months or more mulling over their investor deck, and you look at it and within 15 minutes, you're like, that's not clear, that's missing. Yep. I mean, it's just, when you're in it, you can't see what you can see when you're on the outside.
Right.
Yeah. Well, thank you so much for sharing your wisdom with our audience today. How can folks get a hold of you if they want to connect with you further?
Thanks. I'm very easy to find. As you said, I'm at Baltiboy on Twitter. Matthew at MatthewHolt.net is my email, and you can find more about SMACK.health, the consulting part at SMACK, SMACK.health on the web.
Awesome.
There are a bunch of other places you can find me. Google Matthew Holt. There's a male model in London. There's me, and there's a guy who climbs mountains.
Awesome. Well, thank you so much. I appreciate your insights today.
Roxy, it's been a real pleasure talking with you.
Until next time, thank you. What's the difference between launching and commercializing a healthcare innovation? Many people will launch a new product. Few will commercialize it. To learn the difference between launch and commercialization, and to watch past episodes of the show, head to our video show page at drroxy.com. Thanks so much for watching and listening to the show. You can subscribe to the latest episodes on your favorite podcast app, like Apple Podcasts and Spotify, or subscribe to the video episodes on our YouTube channel. No matter the platform, just search COIQ with Dr. Roxy. Until next time, let's raise our COIQ.